Facts about Coronavirus Disease 2019, or COVID-19, brought to you by Monroe County VOCC Employee Services. What is COVID-19? Coronavirus Disease 2019, or COVID-19, is a respiratory illness that can spread from person to person. The virus that causes COVID-19 is a novel coronavirus that was first identified during an investigation into an outbreak in Wuhan, China. How does COVID-19 spread? The virus that causes COVID-19 probably emerged from an animal source, but is now spreading from person to person. The virus is thought to spread mainly between people who are in close contact with one another, within about 6 feet, through respiratory droplets produced when an infected person coughs or sneezes. It also may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes, but this is not thought to be the main way the virus spreads. Preventative actions you can take. Number 1, wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based sanitizer that contains at least 60% alcohol if soap and water are not available. Number 2, avoid touching your eyes, nose, and mouth with unwashed hands. Number 3, avoid close contact with people who are sick. What is the county doing at its workplaces to help prevent the spread of COVID-19? Facilities maintenance is conducting enhanced cleaning on an increased frequency. Hand sanitizers and cleaners are being placed in areas with the greatest contact with the public. Additional supplies will be provided based on availability. Departments are developing their own measures based on the nature of their work. Is the county considering modifying schedules or suspending operations? No, not at this time. The county plans to be open and provide regular public services on an ongoing basis. Each department has begun to evaluate how work will still be accomplished if certain protective measures need to be implemented. What is the county doing in the community outside the workplace to prepare for COVID-19? Monroe County's Emergency Management Department leads periodic interagency coordinating meetings and video conferencing calls to discuss local and regional response plans. These meetings include participants from key stakeholders who are involved in planning and response. Participants include representatives from the Florida Department of Health, local hospitals in the medical community, cities and municipalities within Monroe County, the cruise ship industry, fire rescue departments, Coast Guard, Navy, law enforcement, and several other relevant agencies. In much the same way these organizations coordinate during other types of emergencies, such as hurricanes, they will pool resources and share information that contributes to the common goal of protecting the community. How are Monroe County departments planning to respond? Each department is developing a plan based on the nature of the work so that operations will continue. If the level of risk in our area increases, departments will be able to take additional steps to modify operations in order to continue providing public services to the greatest extent possible. Symptoms include fever, cough, shortness of breath, and may appear 2 to 14 days after exposure. What do I do if I get sick? Employees are encouraged to go to the doctor if they are ill. As with any cold or flu, the county asks you to stay out of work to reduce the risk of making others sick. Remain in regular contact with your supervisor about the absence and any applicable work plan. Stay home except to get medical care. Separate yourself from other people and animals in your home. Call ahead before visiting your doctor. Cover your mouth and nose with a tissue when you cough or sneeze. Throw used tissues in a lined trash can. Immediately wash your hands with soap and water for at least 20 seconds. Wear a face mask. Avoid sharing personal household items. Wash your hands often with soap and water for at least 20 seconds. Clean all high-touch surfaces every day. Monitor your symptoms. Remain under home isolation until the risk of secondary transmission to others is thought to be low. What if I'm okay but a member of my household gets sick? The household member is encouraged to seek medical attention. Distance yourself from the household member according to recommendations which are CDC guidelines. The employee should stay in contact with their supervisor and determine a work plan. If I have medical questions or need medical advice, who can I contact? In addition to your own physician, Monroe County Health Plans offer telemedicine through our vendor, Teladoc. Members participate in an online or phone consultation with a physician without requiring an in-person office visit. Visits can be conducted via smartphone, iPad, PC, or laptop. For more information about Teladoc, please contact the Employee Benefits Department at 305-292-4446 or go to www.teladoc.com to register. Where can I get more information? Additional information can be found on the websites for the World Health Organization, Centers for Disease Control, and the Florida Department of Health. Be on the lookout for CDC information sheets the Safety Department is posting at county facilities. The Employee Benefits Department is adding the topic COVID-19 to the March 2020 Lunch and Learn. Information from Florida Blue, our medical benefit provider, will also be shared separately via regular emails from the Benefits Department. Is there anything else I should know? Stay in contact with your supervisor and make sure your current address and phone number is on file in the Employee Services Department. Contact Elena Thurston at thurston-elena@monroecounty-fl.gov or 305-292-4461 if you need to update your contact information. As new information becomes available, it will be shared.